For this station, like other stations, again, the goal is to get the probe in the patient or the student's hand as quickly as possible. So for this ultrasound, just like any, we're going to use our IAM technique: indication, acquisition, interpretation, and then management. So indications for a DVT scan are a patient comes in with unilateral leg swelling, unilateral erythema, tenderness after they've been immobilized for a while, like a flight, long drive, any injury to the leg. And then for acquisition, the patient's going to be supine in reverse Trendelenburg a little bit, about 35 to 40 degrees. Leg is going to be externally rotated and then slightly flexed at the knee. For a full DVT scan, you're going to scan from the bifurcation of the femoral vein into the great saphenous all the way down to the trifurcation of the popliteal vein into your three main veins of the lower leg. But for the purposes of this scan, we'll just scan the popliteal fossa. So use your linear probe. Again, indicator always towards the patient's right. Pencil grip, and then we're going to go right into the popliteal fossa. So start in the short axis, and then find your popliteal vein. Again, you can use compress, and that's going to usually identify your vein. Now, when you're doing the DVT scan, you compress from the bifurcation to the trifurcation every 1 to 2 centimeters. If it's compressible, then it's likely not going to be DVT. If it's not compressible, then you're more concerned for DVT. Other things you can do are use your color mode, and then center that over your popliteal vein. And the one thing you do is called augmentation. So you find your vein, center it in your screen, and then squeeze the patient's calf. If you see a flow of blood, so it's going to be red with a little bit of blue mixed in there, then you can be more confident that your patient doesn't have a DVT because there's going to be no clot blocking the flow back. One thing you can also sometimes see is the clot itself. It's going to be more hyperechoic to a little hypoechoic. That's not always obvious, so you want to use your other methods like compression and then augmentation. If you do find one, then usually going to treat with heparin. This can be your management, or other blood thinners. If you're still concerned for one but you don't see it yourself, then you're going to want to go to a more formal DVT scan with a